Investigating Radio Live on this matter.
Question number 4, Dr. Paul Hutchison.
Thank you, Mr. Speaker. To the Minister of Health, what improvements, if any, have been made to the government's national health targets?
The Honourable Tony Ryan.
Mr. Speaker, preventive health is very important to this government, and that's why we're lifting health targets in this vital area. So, for example, in the area of immunisation, the target is moving from 2-year-olds to 8-month-olds. And this is important because we will ensure more infants are protected from infectious diseases like measles, whooping cough and pneumococcal disease. When we came to office, only over 70% of 2-year-olds were immunised, just over 70%. Now 92% of 2-year-olds are fully immunised, with virtually no difference between the rates for Maori, Pacific and general New Zealanders. We've also announced the new target for more heart and diabetes checks, which will be very important for preventing, detecting and managing heart disease and diabetes.
Supplementary. Thank you, Mr. Speaker. To the Minister of Health, what other improvements are being made to deliver shorter waits for cancer treatment?
The Honourable Tony Ryan.
Well, Mr. Speaker, the government's announced that we're strengthening the cancer waiting times target by including chemotherapy in the shorter waits target. And so on the 1st of July 2012, all cancer patients ready for radiation or chemotherapy treatment should begin that treatment within the world gold standard of 4 weeks. Just a few years ago, people had to travel to Australia for vital radiation treatment, and no one has had to do this since late 2008.
The Honourable Marion Street.
A supplementary question, Mr. Speaker. If the Minister considers prevention a useful part of improving New Zealanders' health and achieving these health targets, how will the prevention of obesity and all its contingent diseases be achieved, given the fact that nutrition and physical exercise programs such as Healthy Eating, Healthy Action and Mission On have been axed?
The Honourable Tony Ryan.
Well, actually, the government's spending many, many millions of dollars promoting healthy eating and healthy action. We certainly have got a huge investment, particularly in the Kiwi Sport program, championed by the Prime Minister, where $20 million is going in to help schools make young people more active. Our young people today are now far less active than they were 20 years ago, and that's why the Kiwi Sport investment is so important to dealing with that.
The Honourable Marion Street.
Supplementary. So if the Minister does consider prevention a useful part of achieving health targets, what preventative measures is he promoting to address the health effects of increasing inequality as described in the New Zealand Herald today?
The Honourable Tony Ryle.
Oh, Mr. Speaker, look, I think the government's making huge progress in improving the standard of health care for all New Zealanders. New Zealand's standard levels of rheumatic fever were at scandalous third world levels under the previous Labour government. Annette King made it a health priority in 2001 and then did absolutely nothing about it. This government is investing $24 million over 3 years in a program to stamp out rheumatic fever, a third world disease that party opposite talked about and did absolutely nothing about.
Dr. Paul Hutchison.
Thank you, Mr. Speaker. To the Minister of Health, why is the government lifting performance in the health targets?
The Honourable Tony Ryle.
Thank you, Mr. Speaker. It's a very good question, because the national health targets drive improved public services right across the health system. You can't speed up an emergency department without improving the way that a whole hospital runs, with quicker access to X-rays, MRIs or CTs, to a bed or to surgery. You can't immunise more kids if you haven't got primary care working well. And you can't provide more heart and diabetes checks if hospitals and primary care aren't working together. That is the success of the national health targets. It's driving whole of systems performance improvement.
Question number 5, the Honourable Leanne Dalzell.
Mr. Speaker, my question is to the Minister for